Hi, good afternoon, everyone. I'm just giving it a few seconds for everyone to join us before we get started. I think everyone's coming through now, so we should be good. Yeah, looks like. So, afternoon, everyone. I'm delighted to extend a warm welcome to you all to our RCSI and HSE Nursing Education webinar, Exploring Postgraduate Education and Funding Solutions. It's a pleasure to see such a diverse and esteemed group of participants gathered here today. My name is Tara Hyland and I'm a Student Recruitment Advisor here at RCSI Online, and I'll be your host today. Before we commence, I'd like to extend my sincere appreciation to our speakers, participants and organisers who've contributed their time, knowledge and passion to making this webinar possible. So as we get started, I just want to firstly run through some housekeeping. So your microphones will be muted for the duration of this session, and we welcome you to input any questions you have into the Q&A box, and we'll answer these at the very end when we get to the Q&A section. If we don't answer your question whilst we're here today, we'll be sure to follow up with you afterwards. And it's also worth noting that today's session is going to be recorded. I'm now delighted to introduce you to today's speakers. So we have Maria Flaherty, who works in the HSE as a Nursing and Midwifery Planning and Development Unit, so the NMPDU officer. Maria will use her vast experience to provide us with an overview of the Office of Nursing and Midwifery Services Director and the NMPDU. So the role of the ONSMD plays in professional development funding will be looked into by Maria, and then the HSE funding structures and practical guidelines for nurses to be able to apply. We're also happy to welcome Catherine White, who's an alumnus and a joint faculty here at RCSI, to discuss her experience studying postgraduate education and the value of postgraduate education to nurses in the workplace. Thank you both for joining us today. And now who's going to be introducing Maria and opening the webinar is our Executive Director, Sarah MacDonald. Thanks, Sarah.
Great. Thanks very much, Tara. Good afternoon, everyone. I'm absolutely delighted to open this important event today, showcasing postgraduate education and professional development at RCSI, particularly as relates to nursing education provision. RCSI is in a unique position as a higher education institution in that our focus is wholly and completely on healthcare. Our research, education and community activities are all centred on the betterment of patient care. This creates an unrivalled opportunity for interdisciplinary collaboration, enabling healthcare professionals from all disciplines and levels to learn and study side by side, a mirror of the multidisciplinary healthcare environment with its myriad of challenges and nuances. Nursing has been one of the core disciplines at RCSI for many decades, with thousands of nurses having advanced their careers through postgraduate education at this university. Now, with the benefit of online and digital-first education provision, barriers are reduced and education and development opportunities can be accessed regardless of where you are in the country and no matter the level of complexity of work and personal schedules to be managed. We are proud that so many nurses have accessed postgraduate and professional development opportunities at RCSI. With the dedicated expert School of Nursing and Midwifery, our Faculty of Nursing and Midwifery, and our Graduate School of Healthcare Management, where nurses comprise over 40% of all master's programme cohorts and learn alongside their healthcare professional peers. We are acutely aware of the impactful role that the NMPDU play in supporting nurse education. Testament to this is the fact that 70% of the nurses who return to study at RCSI are funded. The NMPDU are a vital supporter of the professional development and enhancement of nurses in Ireland, and we are delighted to collaborate with them on this event today to create awareness of their contribution to nursing workforce advancement. Indeed, RCSI and the Graduate School of Healthcare Management in particular have a long-standing relationship with the HSE and have collaborated on many educational initiatives, including work with the Clinical Directors Programme and the National Clinical Leadership Centre. So again, we are delighted to be adding another facet to our cooperative and positive relationship with the HSE. Today's event is a great opportunity for nurses and midwives to learn more about funding and the process to access this funding, eligibility criteria, the value of postgrad education for nurses and the career impact that this has, and importantly, what is available for nurses at postgrad level at RCSI. I really hope you find this session valuable today and enjoy listening to the great speakers to follow. I am now delighted to hand over to Maria Flaherty, NMPDU Officer at the Office of the Nursing and Midwifery Services Director, HSE Dublin North.
Thank you, Sarah, and welcome everybody. My name's Maria Flaherty. I'm a Project Officer Assistant Director of Nursing in the NMPDU in North Dublin, and I'm delighted to have this opportunity with you today. Next slide, please. So I've been asked to talk to you about professional development funding in the Office of Nursing and Midwifery Service Directorate. Next slide, please. So what we're going to look at today is the structure, role and function of the Office of Nursing and Midwifery Service Director and the Nursing and Midwifery Planning and Development Units. We're going to look at our role with regard to professional development funding for nurses and midwives. We're going to look at the HSE HR 020 postgraduate funding circular and anything else that you need to know. Next slide, please. So this is a complex organogram of the structure of the Office of Nursing and Midwifery Service Directorate. But what you need to know is we are led by Director Dr. Geraldine Shaw and supported by a senior leadership team. There are 4 nursing and midwifery planning and development areas across the country with 8 regional units, 12 centres of nursing and midwifery 12 centres of nursing and midwifery education, a national clinical leadership centre, and there are national leads on specific programmes and portfolios for nursing and midwifery. And we sit in under the office of the Chief Clinical Officer, Dr. Colm Henry. Next slide, please. So there are 8 NMPDUs throughout the country with 12 centres of nursing and midwifery education, and we all work collaboratively together. If you see up in the box on the right hand corner, there are specific standalone nursing and midwifery leadership roles within the Office of Nursing and Midwifery Service Directorate that cover areas such as midwifery, public health nursing and education, to name but a few. Next slide, please. So this breaks down what NMPDU covers what county in Ireland, and this is important for everybody that's on the webinar today. So we have 2 units in the south of the country, one in Cork Kerry that covers counties Cork and Kerry, one in Kilkenny that covers Carlow, Kilkenny, Waterford, Wexford and South Tipperary. There is a unit in Palmerstown in Dublin that covers Dublin, South Kildare and Wicklow, which are the areas of Dublin South City and County, Kildare and Wicklow. There is a unit in the Midlands which covers Leitch, Offaly, Longford, Westmeath. There is the unit that I work in North Dublin that we cover North Dublin City and County. There is a unit in RD that covers Louth, Meath, Cavan and Monaghan. A unit in Donegal that covers Donegal, Sligo, Leitrim and West Cavan. And finally, a unit in the West Midwest, which covers Galway, Mayo, Roscommon, Limerick, Clare and North Tipperary. Next slide, please. So this slide goes through the strategic approach of the Office of Nursing and Midwifery Service Director, our vision, mission, values and goals. Our vision being to achieve excellence in nursing and midwifery care. Our mission is to lead and enable the nursing and midwifery professions to provide high quality care. Our values are care, compassion, commitment, trust and learning, and our goals are to strengthen capacity and capability within the workforce, to support the delivery of service priorities and reform, to influence policy and to provide a person-centred approach to care delivery. And these all are aligned with Sláinte Care, the HSE corporate and annual service plans, the Office of the Chief Nursing Office in the Department of Health and NMBI. Next slide, please. So the Office of Nursing and Midwifery Service Directorate has 4 strategic priorities, 1 being clinical expertise, 2 being quality and safety, 3 being change and transformation, and 4 being service user engagement. And myself and my colleagues throughout the country, all the programmes we work on a day-to-day basis are all aligned under these strategic priorities. Next slide, please. So the Office of Nursing and Midwifery Service Director provide a focal point for nursing and midwifery within the public health system. We are a critical point, a professional link with the Department of Health, the Chief Nurse's Office, the Nursing and Midwifery Board of Ireland, educational bodies, the HSE Board and Leadership Team, the Office of Health and Social Care Professionals, Group Area Directors of Nursing and Midwifery, and other stakeholders to enable the development and implementation of policy and regulation in regards to clinical practice for nursing and midwifery. We provide visible and informed clinical leadership to nurses and midwives and healthcare assistants under our governance and function. We build strengthen workforce capacity, capability and resilience whilst driving clinically enabled healthcare improvement and reform in line with Sláinte Care. Within our scope of governance, we design, develop and deliver continual professional development and clinical leadership with programmes of education ranging from level 5 to level 8 on the National Framework for Qualifications. And we're commissioned and provide funding for level 8 and level 9 programmes of education aligned with service need. Next slide, please. So other functions within the Office of Nursing and Midwifery Service Directorate is we support the Chief Clinical Officer by providing individual staff resources to lead on specific aspects of integrated care, delivery and design and innovation for patient quality and safety. We provide professional guidance and expertise at national, corporate and local level to support strategic planning, implementation and development of policies, procedures, protocols and guidelines for delivery of safe, evidence-based practice. We support the Department of Health Office of the Chief Nursing Officer in the analysis and application of legislation and implementation of policy. We enable nursing and midwifery leaders to deliver on digital health, standardised terminologies and data sets. We collect and analyse data nationally to inform and support decision making as it relates to nursing and midwifery, and we manage budgets and provide the design, development and delivery of continual professional education. Next slide, please. So this is the bit that you're all interested in. This is the first page of the HSE circular 020-2024 for postgraduate funding. So the Nursing and Midwifery Planning and Development Units throughout the country administer the application of this circular on behalf of the HSE. The circular applies to the sponsorship of nurses and midwives to undertake programmes of education, the conditions under which they will be sponsored by the HSE. Courses are undertaken to must be relevant to the area of nursing or midwifery practice or meet patient or organisational needs. Next slide, please. So the next slide is page 2 of the circular, and we'll go on to the slide after that, slide 3, which is the 3rd page of the circular. If you Google the circular, you will be able to read it in detail. I know it's very small on these slides, but it's very important to read it in detail because there are specific terms and conditions which I will briefly go through now. So what's in scope? Next slide, please. So nurses and midwives in the HSE and HSE funded agencies, section 38, who do not have a direct continuing education and funding stream within their baseline budget. And if you are not sure if you are in one of these organisations, your director of nursing will know. Secondly, what's in scope is courses undertaken must be relevant to your area of practice or must meet a patient or organisational need. And if you're not sure about this, you should talk to your line manager and they will be able to advise you. Next slide, please. Oh, I think we skipped a slide. Oh no, we didn't, apologies. So apologies, we go back, yeah, out of scope. So what nurses that are not covered within this circular are, if you work as agency or as a nurse or a midwife, if you are employed in private hospitals, private nursing homes, if you're self-employed as a community midwife, or if you are a nurse or midwife working in general practice. Next slide, please. So to be eligible for funding, you must be registered with the Nursing and Midwifery Board of Ireland. You must be employed in the public health service, and you may not have received funding within the last 36 months in under the circular. Next slide, please. So additionally, successful applications for sponsorship will be required to give written undertaking to their employer that they will, following successful completion of the programme, work for their employer for a minimum period of 12 months or for the length of the academic course undertaken, whichever is longer. And secondly, you must have a satisfactory employment record as determined by your line manager. Next slide, please. The courses funded will only be provided for funding will only be provided for courses run in the state and at the fee applicable to an EU citizen. Any amount in excess of the fee applicable to the EU citizen will not be funded under the terms of the circular. In exceptional circumstances where the required education is not available in the state, funding may be sanctioned for courses provided outside of the state, but this will only be considered on a case-by-case basis. No funding will be provided for repeat of modules, units of study or examinations. All associated costs must be borne by the nurse or midwife concerned. Repayment of fees and salaries where an employee is required to repeat elements of the programme, they must remain in the employment of their current employer during this period. If you cease employment or do not complete the programme, you will have your sponsorship terminated and will be required to repay fees. Such payments shall be made to the employer you currently work with, and in exceptional circumstances, all of the above repayments may be waived, but this is at the discretion of your employee. Any additional costs, such as charges or expenses, including travel, textbooks, library charges, these are incurred by the nurse or midwife undertaking the programme. Next slide, please. So this is the level of funding that is covered. So for a certificate programme, it's 100% funding. For a postgraduate, it's 100% funding. For a master's, it is 75% accumulative. And what this means is, if you take a 2-year master's programme and let's say the course costs 10,000 euros and the first year of it you have to pay 7,500, then the second year will be borne by the nurse. So it's 75% of the accumulation of 2 years, and this depends on the educational body how they administer this. And for a candidate advanced nurse practitioner or a candidate advanced midwife practitioner under advanced practice masters, there's 100% funding, but you need to be aware that there is a consortium of 5 colleges that undertake this advanced practice masters with the HSE. There's a service level agreement, and if you go outside of these colleges, this 100% funding is not provided. Next slide, please. So before you apply for funding, you need to arrange to meet with your line manager and discuss everything that I've just talked about in the last few slides, which includes exploring opportunities of support available to you. And this is a perfect opportunity to complete your professional development plan and write in your postgraduate education into something that you want to achieve within your professional development plan. Next slide, please. So the steps for applying for funding. The first step is read the funding application process details, including the circular, the 4 pages. Then you complete your local funding support request form. Each application must be supported by your Director of Nursing and/or your line manager. And you must submit the completed application form to your local nursing and midwifery planning and development unit. Next slide, please. So what other considerations may you have? So when you're thinking about what postgraduate education course you want to undertake, what are you interested in? Where do you want your career to go? And what do you want to be when you grow up? When we were all young nurses, there was aspirations for where you wanted to go in your career. You should consider that. And what opportunities will the programme give you? Will it open doors to maybe becoming a manager or to going into research, for example? What is relevant to your area of practice? And have you professional and personal support when you undertake this programme of education? Next slide, please. So this is a link to all the different NMPDUs. So the OMSD has a comprehensive website where everything that I have discussed today is freely available for people. If you Google it, you will find it. And then there is a link to the contact person throughout the country when you go to apply for these funding streams. Next slide, please. This is just a brief piece of information. On top of postgraduate funding, NMPDUs also provide a funding pathway for continuous professional development training. This is only available to HSE funded services, and you have to apply via your line manager. Your Director of Nursing and your line manager will be aware if the organisation you work in is eligible for this funding stream. And there is also an additional funding stream called Service Innovation, and this is available for HSE and voluntary services, and it is additionally administered via the Director of Nursing or Midwifery's office. All of these approval is by your line manager, that you don't contact. You can of course contact NMPDUs for queries, but we will not approve anything that line managers or directors of nursing have not approved first. So you can contact us for queries, but we will always refer you back to your organisation. And the 3 funding pathways are opened once a year, and we communicate via the Director of Nursing and Midwifery's office, and then we expect it to be circulated down through the organisation you work in, so you're informed about it. Next slide, please. So the takeaway messages from my presentation today is talk to your line manager and complete your PDP when you're considering taking on additional postgraduate training. Make sure you have approval from your director of nursing or midwifery. Think about what's relevant to your area of practice, and you're responsible additionally for engaging with the educational body or the college, university in tandem with obtaining the funding stream. So there's 2 things when you undertake postgraduate education. You're looking into getting the funding, and secondly, you're engaging with the educational body to determine which programme you want to undertake. Next slide, please.
Thanks, Maria, for providing a thorough overview of the funding scheme structure, the eligible nurses, the level of funding, and then the process required in order to apply. I'm sure this will be hugely beneficial to our attendees here today. We are going to save our questions for the Q&A at the end, but one question has just come through that I might put your way. So there was an individual asking if there's a particular, what should they really include in their application? So is there anything in particular I should include in my application to make it more likely for funding to be approved? Is there anything you can suggest, or is it that when all the boxes are ticked, essentially the funding will be approved and there's no cap on that? Or is there any advice that you can give in that area?
What I would say is the NMPDU are not in the business of not funding nurses. We are in the business of building capacity and capability within nursing and midwifery to advance and improve healthcare. So if you fill all the forms out correctly and you engage with your line manager and your director of nursing or midwifery and you have approval for them, it's unlikely that the NMPDU will say no. If the NMPDU is saying no, it's probably because you haven't ticked all the boxes that I've just talked about in my presentations there, Tara.
Brilliant, great. Thanks, Maria. I hope that answers your question, but yeah, it's great to hear it. At least it gives people that confidence that if they go through the right steps, and fingers crossed, it will come through on the other end.
And to reassure you, the NMPDU fund thousands of nurses to undertake postgraduate education every single year.
Great to hear. So now that we have an understanding of what funding HSE nurses can avail of, can we have the next slide, Ash? And I'm going to welcome Catherine White to join me for a Q&A on postgraduate education for nurses. And thank you again, Maria. Next slide, please. Just waiting for the Q&A to pop up, and then we'll get started speaking to Catherine. Brilliant. So Catherine, welcome today. Thank you also for joining us. So Catherine finished a master's with us in Masters in Leadership in RCSI in 2016. And she's also been studying in her extending her postgraduate qualification ever since she qualified as a nurse. So she really has a thorough understanding of the importance of postgraduate education. And today she's here to really discuss with me the benefits of that and why she feels it's hugely potential to nurses in the workplace. So we're going to get straight into the questions, Catherine, if that's okay. Brilliant. So you have regularly re-engaged with third level education since you qualified as a nurse in 1992. So what motivates you to study at postgraduate level, and why have you returned to study?
First of all, Tara, thank you very much for having me, and to the RCSI for having me on today's presentation. It's an absolute pleasure to be here. To answer your question, I would say I've possibly never stopped studying, to be quite honest, since I started my career in nursing. And when I reflect back to when I qualified as an RGN, a registered general nurse, under the apprenticeship model in 1992, which is 32 years ago now, you know, to me, it only seems like a few years ago that the time has gone so quickly. Since that time, I think I've always had an inherent interest in learning more, and I think that's the curiosity within me. And I think for as long as you have that curiosity within you, nursing is a profession that has so many diverse pathways that you can go on, particularly now. It was a bit more restrictive in my time, 32 years ago, but there is so much diversity now that Maria has already alluded to. And, you know, what programs can provide for us, be it online, virtual, digital, not just face-to-face programs. So I think that sense of curiosity has remained with me throughout, and I've continuously been asking the questions, and every time I ask the questions, it opens another door for me, and then it progresses me on to the next study day, the next program. It's not always about postgraduate academic formal education. I think it's about learning in general in the context that you're working within, and there's loads of study days and continuous professional development that you can do within your own workplace that I think of, as well as your formal academic education. So I think it's that inherent sense of curiosity that has kept me motivated throughout the years.
Kept you going, yeah, exactly. And when you did complete your Masters in Leadership with RCSI, what was your experience of being on the Masters programme and studying it throughout? Was there any positives or challenges that you faced throughout the programme?
Yeah, well, certainly, I think at that stage of my career, I had progressed from being staff nurse from right up through the ranks of CLM2, Assistant Director of Nursing, and then on to Director of Nursing. And I'd been a Director of Nursing for a number of years, and I kind of felt the need to, I suppose, rejuvenate my leadership portfolio, which is what got me interested in the RCSI and doing that Masters in Leadership. So certainly it was my first time attending the college at that stage, and I really found it very welcoming, would be the first thing. I very much felt at ease. I lived in Cork at the time, and I naturally had family commitments. I was working full-time in my career, and it was a huge, I suppose, undertaking to travel to Dublin to attend the face-to-face schedule for the 2 years that programme was rolled out. And I graduated in 2016, having completed my Masters in Leadership in the RCSI, and I can honestly say they were two of the best years of my life, and I'm not just saying that, but I just think it created opportunities, it opened doors for me, it created a whole wealth of new experiences that I could never have experienced otherwise, from the way the programme was presented, from the guest speakers. I think it was, you know, and I think it's kind of, you know, from the work I've had with the RCSI since, it's a very agile programme. The RCSI work with what's current at the time, and what you said initially, the RCSI is dedicated to healthcare. which I think is hugely significant. And in addition to that, we were exposed to other professionals attending that programme. So I worked alongside pharmacists, doctors, dentists, not just nurses. But we all had the one common goal of healthcare in mind and providing quality service to our patients. So I think with that in mind, it really opened my horizons for me. The way the study was presented as well, from the perspective that they were very supportive of our needs and very supportive of the fact that we were working full-time and at postgraduate level. And the agendas, I think, coincided with that, and the way the programmes were set up. And it was very much a co-design approach. So whatever worked for us worked well for us, and we did more of that. And perhaps things that didn't work so well for us, we negotiated that, and that was, reorganised. And I think that was really important, because they really listened to us as learners participating in their programmes. And I do think they provide us with a huge variety of opportunity for learning. So it was hugely positive for me.
Brilliant. It's always great to hear. And I know you've mentioned, your passion for learning and want to learn more throughout your career, and how that helps you in a personal sense because you have that drive. But do you think, in what way has continuing education as a whole helped your professional growth in nursing? Is there anything you can pinpoint in yourself, or maybe in other nurses that you've worked with, where you see them grow as a nurse, and how their professional skill set has expanded through continuing their education?
Absolutely. I think, as soon as you get involved in education, it just opens doors. It opens your horizons to a whole new way of thinking. You start to think critically. You start to analyse things. You started to question things, perhaps in a way that you may not have questioned already, because you're instantaneously curious. So I think from a professional level, I have never stopped. And I would say that course that I completed in leadership in the RCSI is the one course that has really catapulted me from working at local, regional level to working at national level. So it opened many doors for me from that perspective. So through the networking events, through conferences, and through meeting other people and liaising and networking with fellow colleagues and peers. So it exposed me to a whole new platform that perhaps I may not have considered before, because I would have been very focused working regionally as opposed to working nationally. So it gave me a whole new insight into that. I think from professional development perspective, it goes without saying that, as you're learning, you're growing naturally, and you're not just growing on a professional level, you're also growing at a personal level, and very much the two are interlinked, because you start to understand what it is about you that you want to learn more about, and what it is about you that you need further information on, and what it is about you that you're really passionate about and that you really enjoy doing, and then what are the things that challenge you as well, and it really gets you to think more about those. So professionally and personally, I would say in education is something that it can't but benefit you. And for me, and from my experience, since I graduated since 2016, I came away thinking, that's it now, I've my master's in leadership done, without actually realising that I just opened the door to a brand new chapter in my life, and that door has continued to open ever since. So I think that's what it gives you.
Brilliant. And have you found that your postgraduate studies have helped you stay up to date with current or the latest advancements in healthcare? Has there been exposure to that, or maybe even just encouraging you to look into latest advancements?
Absolutely. I think when you're exposed to an education, everything you do is up to date and current, and the RCSI certainly would have encouraged that. Whatever was topical at the time is what we had to research and work on. So you become naturally exposed to that, and you become naturally exposed to looking at media, to looking at grey literature is what we would have called it, looking at policy development, keeping up to date with what's happening in the HSE currently. So that becomes a natural forum for everything that you do in relation to the master's programme. So then when you go into life, it just becomes automatic. You just want to be up to date. You want to know what the latest is. Even as the COVID experience happened, you remain up to date on the latest findings and how that progresses. So it's not that it just becomes a matter of forms, what I would say. I would consider myself missing out on something if I wasn't up to date. So if I don't have the information at hand, I naturally seek it out for myself. And I think that's the difference between, that's what the education programme and that's what the postgraduate programme does for you. It makes you naturally inclined to do that for yourself automatically.
Yeah, it's great to hear that it prompts that initiative or the motivation to want to learn more and to be aware of what's out there. And have you found, I know you've mentioned that when you're on your master's, you of course were with other healthcare professionals. Have you found that your studies have helped you build relationships with your colleagues and then maybe healthcare professionals outside of nursing within your workplace?
Absolutely, and not only just with my fellow colleagues and peers, but I think, you know, the Masters has encouraged me to reach out to other areas nationally as well, and other colleagues. And since I did my Masters, I've reached out to the NMPDU that Maria has spoken about. I've worked with the National Clinical Leadership Centre. I spent 3 years working on a secondment with them, and that has catapulted me into another area as a project manager in the NMPDU, working under the classroom management system and that digital space, which is a whole new era for me. But if you think about it, it's all linked to leadership and leadership development, and it's how you expose yourself. And what I would say to people is nobody's going to come looking for you. You're going to have to actually put yourself out there. And I think that's really critical and it's really important. And I think, you know, growing up and going through school, and I often think back at that time, and even going through my education as a registered general nurse, I would have been one of the quieter ones. So, you know, I wouldn't have been the one that would have stood up in the middle of the classroom and exposed myself, so to speak, with my knowledge and so on. But now I'm the first one that's out there doing that, because I see the value in it. And that's what the leadership and master's program has taught me, that you do have to put yourself out there. You do have to create those connections. It might seem a little bit uncomfortable for a little while, but once you build up your confidence and get your knowledge behind you, then it becomes much easier as time progresses. And that's what it has done for me. So I think that's what it would do for anybody really that would put themselves through that process.
Yeah, I'm just helping them to build that confidence by being exposed to other individuals. And
yeah,
I suppose when you're more
exactly.
up to date in certain areas of healthcare, it gives you more confidence to talk about it and then mix with other individuals or other colleagues or different healthcare professionals, because you're confident in what you're talking about to them.
Absolutely, absolutely.
Brilliant. And then would you say that your study has enhanced your critical thinking? I know you've mentioned this really, and then also your problem solving abilities as a nurse.
Yes, it's absolutely enhanced that. It's one of the things that you have to do. So you have to start to think differently as soon as you're exposed to this level of education. And one thing I liked about the RCSI is the fact that we did a lot of education in group work. So we had to work within groups. So it wasn't just your opinion that counted. You had to consider the opinion of others. And one of the things that we did a lot of was working on case studies. So real life case studies, scenarios that had happened. And we reflected on those and how we would manage in those situations. And, you know, I often wondered, you know, how other people might think completely differently to me at the opposite end of the scale. And then you'd have to bring yourself, well, how do you bring them along with you? Or how do you change your I suppose, sense of direction to align yourself with them, because at the end of the day, we all have to get through the problem scenario together. So it really enhanced our need to react differently, think differently, listen attentively, which I think was a huge part of leadership and something that I really learned. And I know we were exposed to people like Michael West, who's our guru in compassionate leadership, and the RCSI has had him attend many of your conferences and events. And one of the things that he speaks about is listening with fascination to other people. And that's one of the things I really learned about leadership. It's listening to other people and trying to understand things from their perspective. So being exposed to all that critical analysis and critical thinking is hugely important, because it builds your stamina, it builds your own portfolio as a leader. It allows you to be confident in yourself. It allows you to delve deep into your own abilities and your own value system and what matters to you, and what you can add value to in your career, which I think is really, really important.
Brilliant. Thanks, Catherine. And then as a final question, so what would you say to our nurses in the audience today who are considering postgraduate education? Is there any advice you'd give them, or any tips that you've learned along the way, or, you know, motivational factors that you think would be important to them?
Yeah, I think there's huge opportunity now, so that's really exciting. That's the first thing. So there's a huge wealth of courses available to you. So I would say you probably need to reflect on that, reflect on it from the point of view of what it is you really want. And as Maria has said already in her presentation, how can you build on your career? What's your professional development plan? What area are you most interested in? Do you need to expose yourself to other areas, perhaps, if your breadth of experience isn't quite wide enough just yet? So they're the kind of things that I would do. And then maybe talk to your line manager, talk to your colleagues, talk to other people who've been exposed to education programs that perhaps you might be interested in. And then armed with that knowledge, I would really kind of start to narrow it down, maybe look at the realistic options for you, dates, timetables, so on. Time passes really quickly. That's the one thing I would say. And, you know, not that, you know, I suppose I was never one to let the grass grow under my feet, but I realised that I've been exposed to education for over 30 years now, and I'm still doing another master's programme as we speak today. So, you know, you need to find out what your niche is, you need to find out what your interest is, and then take a deeper dive into that and start to look up the programmes that you feel might add value to your career. And I would say, I suppose from my perspective, it's and in the words of Albert Einstein, which I've written here to try and motivate people, it's not about trying to become a person of success, but rather becoming a person of value. And I think that really matters in nursing. It's not as much about how successful you are in your career, but who you can add value to, or what you can add value to as you expose yourself to different scenarios. And that to me is really, really important, is what can I add value to? And that's where I go for my search when I go looking for my education, and as I continue to grow.
Brilliant. Thanks, Catherine. We'll hopefully have some questions come through at the end, but thanks a million for that. It was very informative, and I feel that it provides people with a real insight as to what it's been like for yourself to be working as a nurse and then to take on the education, and even doing a master's at the moment and still joining us today. So we're extremely grateful for your time today. And as I say, hopefully we'll have some questions at the end. If anyone does have questions for Catherine, feel free to pop them into the Q&A. And like I say, in the Q&A section at the end, we'll pop them up as well and see if we can help you any further. But thanks again, Catherine.
Okay, thank you for having me.
Thank you. Next slide, please, Ash. So just again, say thank you to Maria and Catherine for your expertise and commitment to advancing nursing education. Your insights will undoubtedly contribute to meaningful discussions and help us explore the practical solutions and any challenges faced in the field. Now, as we transition to the next section of our webinar, I'm excited to focus specifically on postgraduate education and opportunities for nurses and midwives within RCSI. Next slide, please. So founded in 1784, RCSI has been educating healthcare professionals for almost 240 years. As the only university in Ireland with a singular health focus, as Sarah mentioned, RCSI is in a unique position to be able to support healthcare professionals throughout their careers. And then from their qualification through to their postgraduate and onwards, we aim to support ongoing continuous professional development needs. We're then committed to supporting our students to elevate their careers and, most importantly, deliver better patient outcomes. And we believe that our drive to deliver quality is reflected really in our global rankings. We're in the top 2% of the World University rankings in 2022, as well as being Sunday Times University of the Year for student engagement in 2022. As you may see, our courses are accredited by the National University of Ireland, which gives them a real national and international trust mark in education. And as Sarah mentioned, we offer nursing education across a breadth of highly relevant and topical subject areas, aligned with identified needs and services and the healthcare system. So the Graduate School of Healthcare Management specialises in healthcare management, leadership, quality and safety, and digital health, whereby the School of Nursing offers pathways to specialise in nursing areas such as wound management, infection control, surgical nursing, and occupational health, and more. And we will get into these later on too. Next slide, please, Ash. So when it comes to online learning at RCSI, we know it can be quite daunting to take on online courses, and since COVID, it does seem to be the norm, but we try to ensure that you are supported if you do join any of the programs. So you feel that whilst it may be a new platform for you, you've never taken on a technical course or gone into a learning environment like this, we try to make sure that you are supported. So from the get-go to the very end, we try to make sure that you feel like you are getting the most you can out of the course. So as part of that, our programs offer a learning experience that is really centered to the learner. So with RCS Online, we focused on 3 key pillars. So interactive online learning. So our online programs offer users a safe and stimulating learning environment throughout their studies, no matter your level of technical ability, as I mentioned. Learning edge or leading edge programs which are innovative and take a keen focus on areas such as digital health transformation to augment clinical and specialist knowledge. We then try to empower content which aims to encourage healthcare professionals to engage with latest ideas and practice. Like Catherine mentioned, having that having that exposure to new areas in healthcare almost prompts you then to look at different areas or do research into more areas, and always try to feel like you're up to date as much as you can be. And we do try to ensure that. So the content you receive is the most up to date, but then it almost triggers that motivation to want to stay up to date going forward in your careers. We then have a seamless experience as to ensure that while you're doing the online learning, and it may be completely new for some of you, our virtual learning environment, or VLE, is intuitive, accessible, and easy to navigate. So at the start of the course, for instance, you will have a program coordinator who will guide you through, but also there'll be short online orientation videos, which will be available to you to make sure you're familiarized with the platform and the course content. So before the module actually begins, you're in there on the platform, making sure you're comfortable navigating it before you really get stuck into the content when module 1 on the program begins. Next slide, please. And then just a quick overview of the programs we do have at RCSI online, courses that are available to nurses, in case it was of interest, of course, to any of you. So we have our masters, which range from healthcare management, leadership and innovation, quality and safety in healthcare management, all with September intakes. Then we have our postgraduate and professional diplomas. So health professions education, which commences in August, and then clinical leadership and leading digital health transformation, which have a spring, so starting very soon, and autumn intakes. And then we have our nursing specific courses. So they're the courses that are open to all healthcare professionals and nurses, whereas these courses are set aside, they're specifically for nurses who have a nursing registration in their country of practice. So with that, you have wound management and tissue viability, and then advanced leadership. Each of these has 3 pathways. They have a master's, postgraduate diploma, and postgraduate certificate, and they typically start in the autumn with a January intake for the wound management postgraduate certificate. With these programs, we do say that if you're unsure of what suits you, or if you're maybe looking into them and say the nursing ones, not too sure which pathway to take, you can of course touch base with us after the webinar today and we'll be happy to guide you. But it is worth noting as well, the courses are accredited by the National University of Ireland and the Royal College of Surgeons in Ireland, and they're fully online, so there's no on-campus presence required. But like I say, any questions afterwards, feel free to touch base. Next slide, please. And then in terms of other postgraduate programs for nurses in RCSI, you have medical nursing, neonatal intensive care nursing, occupational health, positive health, peri-operative nursing, primary community and continuing care, respiratory care nursing practice, human factors and patient safety, advanced practice nursing, which of course Maria has mentioned in terms of funding schemes, and then healthcare ethics and law. So if any of these are interested to you at all, just let us know and we'll put you in touch with the relevant teams. But it is worth noting that, as Maria said, in terms of the funding, have those conversations in your workplace to really determine what course is beneficial for you, what course is going to help the workplace and help long term even. And then, you know, when you put that information into your application form, goes through to the NMPDU, and if all the boxes are taken, they're happy that it's, in the long term it is a benefit to healthcare in Ireland essentially. Fingers crossed you'll get the funding, but it's worth just seeing really what suits you. So if you have any questions, a bit hesitant as to what course is the right pathway, let us know. And if it's not ourselves who are over that course, we'll of course then put you in contact with the relevant teams. Next slide, please. And then we realise for some of you, you may have qualified pre-degree status, so you will have a diploma, and you may have seen that some courses will state that, for instance, a bachelor's is part of the requirements. But please be assured that you can still access our postgraduate and master's courses on the basis of prior learning as a healthcare professional. And then, as you mentioned, we do try to ensure that when you join the programme, you have that support. So you will have support from orientation through to meeting with your program coordinator, and you can always ask any questions along the way. The team want to ensure that no matter your technical ability, no matter if your first time come back to education in a while, that you feel supported and that you get the best you can from the programme to help yourself and your career in the long run. Next slide, please. Right, so we're now going to open up and see if there's any questions you have. Of course, if you've got questions for myself, Maria or Catherine, please feel free to pop them into the Q&A and I'll just read them aloud, any questions to the right team. But as I said at the start, if there's questions in there that we don't answer today, we'll of course touch base with you directly afterwards. So feel free to pop anything in and we'll be happy to help. Okay, there's some specific questions in general, Maria, about whether transportation and accommodation and elements such as that are included in the funding. From what I've said, from what I remember you saying, they aren't.
No.
So the funding scheme specifically cover the tuition fees.
Yes, that's it exactly, Tara. The cost of the college course, everything else is incurred by the nurse.
Brilliant, perfect. I hope that helps answer those two questions. There was one about transport and accommodation. I hope that helps. As Maria says, it's tuition fees. Any other questions at the moment? I will be sharing our contact information anyway, so if any questions follow up, sometimes it takes going away, consuming all the information, and some questions might come up later on, and if they are, just feel free to check in with us and we'll be happy to help, and if it's not ourselves you speak to, we'll be sure to pass you on to the relevant teams.
Tara, I got a question there that I could address if that's okay.
Brilliant,
So I got
a
specific query about a nurse being interested in advancing their career in clinical nurse specialist or advanced nurse practitioner route. And what I would say to that nurse is they need to talk to their line manager first. So if you have a desire to be a clinical nurse specialist or an advanced nurse practitioner, there must be a requirement within the service you work in. So you might like the idea of being an advanced nurse practitioner in a particular field, but if there is no demand for it, whether you work in community nursing or an acute service or mental health or intellectual disability, if the patients or the service users don't require a person with that specialist knowledge, then you will not be able to go down that pathway. So for that nurse, the first thing they need to do is go and talk to their line manager and ask what specific routes that organisation has that requires a clinical nurse specialist or advanced nurse practitioner pathway. And if the nurse is interested in those specific fields, then they can start having that conversation with their line manager. On the OMSD website, there's detailed information with regards to the eligibility criteria there is for being a clinical nurse specialist or an advanced nurse practitioner. But first and foremost, it's a nice idea, but if the service doesn't require it, there is no demand for it, and therefore there'll be no funding or there'll be no post.
Great. Thanks, Maria. Thanks, Maria.
No problem.
Right, so no new questions have come through, so we might close up then, and then, as I say, we'll share our contact information for the next slide, Ashton, just so I can share our email address with everyone. Yes, thank you. So you see, it's the RCSI online email. So if you have any questions, feel free to check in with us. We'll be happy to help. And I'd like to extend a heartfelt thank you to all our participants, Catherine and Maria, for joining us today. We really appreciate it. I think both discussions were hugely important. Maria, from a practical element and understanding what is available to nurses, the best pathways for them to take on, and even how to apply. And I really hope that's been beneficial to everyone joining us today or anyone watching the recording them in the future. And then Catherine, thank you very much for your time also. It's really important for us to have an understanding from someone who's been through it, what postgraduate education means and how it's helped your career and why you think it's important to nurses. It's very clear that you're passionate about it, and we hope that from taking on studies that other nurses too feel passionate about, improving their confidence, but also lighting that flame under them to want to learn more, to know what best practices are, to know what's coming up new in healthcare. So we really appreciate both of your time, and also Sarah for introducing and welcoming the team, and Ash in the background for helping to organise everything here. We really appreciate it. And as I say, if anyone has questions, do feel free to touch base with us. But until next time, take care and all the best, and thank you for your time.
Thank you.
Thank you.
Thanks, everyone.